Nation. Thanks for joining us today. We're joined by Dr. Benjamin England from Blount Memorial Hospital. He's going to be speaking with us today on COVID-19. Dr. England, would you tell us a little bit, what is novel coronavirus and why is it called COVID-19?
Coronavirus is called corona because of its structure. It has this spiky surface to it. It looks like a crown. That's where that gets the name. COVID-19 is a coronavirus that was actually discovered in 2019. COVID means coronavirus disease. So that's where we get the name corona or COVID-19.
Can you tell our student athletes how this virus spreads?
Yes, so it mainly spreads by respiratory droplets. That's through coughing, sneezing, especially breathing to a lesser extent. It can be spread by touching objects that have been exposed as well. We're not sure how infectious that is, but we know that's a part of it as well.
How can I protect myself?
So all the basic things that you hear about in the news at this point. So social distancing is important, limiting the amount of contact you have with people that's not essential. The 6-foot mark is, we know that's a pretty safe space for people. Droplets don't tend to go more than a few feet away from a person, even if they're coughing or sneezing. So 6-foot distance is very important. Wearing a mask is important in public, not touching your face, washing your hands very frequently. All those things can help.
In an athletic setting, how important is it to be wearing a mask?
Well, that's an interesting question. We know that wearing a mask puts less droplets into the air when you breathe, cough, or sneeze. So that decreases the amount of space around you that can have viral particles, or at least less viral particles. So we know it does slow the spread of the virus quite nicely. In contact sports, the guidelines are currently, they're a little bit in flux at this point, but for something like soccer or football, absolutely on the sidelines, everyone has to have a mask on. Anytime a player goes to the sidelines to talk to a coach or anything of that sort, they need to have a mask on for that. During contact at this point, it's not required to have a mask on during play.
They talk about the importance of hand washing, but is hand sanitizer a good alternative for washing your hands?
Yes, it's not preferred. Good hand washing is always preferred. Hand sanitizers, as long as they're at least 60% alcohol, do a very good job, especially if they're covering the hand quite nicely and used pretty frequently.
What should I do if I get sick or if someone in my house or dorm gets sick?
If anyone gets sick, and starts to have symptoms, they need to be tested fairly quickly. As soon as they're sick, they need to be extra careful about all the things we talked about, especially social distancing. Minimize the amount of contact you have with someone while you're sick, which is good to do when you're sick with anything really, but especially this. And that way, we know there's less likely chance you're going to spread it to somebody. And if you get tested quickly, we know exactly what to do as far as treatment.
What should I do if I had close contact with someone who has COVID-19?
Well, close contact at this point, we're describing that as spending at least 15 minutes within 6 feet of a person unprotected that has a confirmed case of it. So if that arises, you do have to quarantine for about 14 days. If during that time you become sick, you change protocol, of course, into a different protocol as far as for illness. But if 14 days you remain asymptomatic and you've checked your temperature twice a day and you've not had any fevers, at that point we can start to integrate you back into the team and around other people.
Can you tell our student athletes what the symptoms and complications are of COVID-19?
Yes, so most of the symptoms are basically the things you think about as far as generalized illness and respiratory illnesses and colds. So fevers and cough, fatigue, muscle aches, headaches. A very common one, or at least one that gets a lot of press, is the loss of taste or smell, sore throat, diarrhea, congestion, runny nose, those types of things. Complications can vary quite a bit. They can be quite severe in some cases, but they're usually very mild. Of course, there's the potential of death, respiratory disease, ventilation, kidney disease. The potential risk is quite broad, but typically not severe.
When should someone seek emergency treatment?
Okay, so anytime you have trouble breathing, not necessarily with exercise, but just trouble breathing with rest and normal daily routine, if you start to have a lot of chest pressure with it, if you start to notice your lips are turning blue or you can't stay awake very well, or if you notice you're more confused. Those are the guidelines from the CDC of big red flags that you need to see an emergency doctor pretty quickly for those.
A big question on everyone's mind is, should I get tested? And if so, when should I get tested?
Okay, so testing depends a little bit on the region and state, and they make that decision based on how common is it in the area and how many tests are available. So currently in Tennessee, we're suggesting testing people that are symptomatic. So if you do show even mild symptoms that fit into this category, it's probably worth being tested at that point.
Who in the community is at high risk for severe illness?
Okay, so uh, we know the patients that do have more chronic diseases tend to do worse. The diseases we think about the most are heart disease, cancer, kidney disease, COPD, which is a lung disease. Asthma probably fits into that category a little bit as well. Sickle cell disease, organ transplants, or anything that's suppressing the immune system, and diabetes, which is very common, of course, too.
Can you explain to our student athletes what is contact tracing?
Contact tracing is usually done when a person is ill. They trace what people they may have had contact with to see, who else needs to be worried about that they've been exposed. Is there a source that's infecting people that may not know it? And try to limit the amount of spread through those, going through those channels. That's usually done through an interview process.
Is all that contact tracing within that 15-minute perimeter, or could it be surface contact? Could it be just casual contact?
Most of it's limited to the close contact just for practicality purposes. Depends a little bit on the situation and who's doing the tracing. Contact tracing, sometimes, especially if someone's in food preparation or something like that, would be a little bit more strict into the contact precautions area.
Can the virus live on surfaces and other objects?
It can. We don't know how infectious it is. We don't know how likely it is to cause a disease from that necessarily, but we know it absolutely can live on the surfaces.
How often should objects around you be disinfected?
Okay, so if we're still learning a little bit about that as far as what's the most practical way to do that. I currently suggest anything that's commonly touched or routinely touched by more than one person, like doorknobs and faucets, the bathroom, needs to be wiped down at least a day, or at least daily. So anything that's shared between people probably should be wiped down in between people. And that includes equipment that athletes have to use. Shared equipment in particular needs to be wiped down.
Student athletes are in a unique environment. What are the safety protocols we can share with them?
Okay, so most of the protocols are based on the guidelines that we already know about for everyone else. The social distancing, I can't stress enough. Hand washing, mask, not touching your face, those types of things. But also with athletes, they need to be particularly careful about not sharing drinking bottles, things like the water bottles, things like that, not utilizing the locker room crowds or not utilizing it at all. And those types of things. Now, after that, it's a little bit more based on sport to sport, but those are the general guidelines for it.
When is it safe to return to sports after being diagnosed with COVID-19?
Assuming you're a symptomatic type person, about 10 days after you started having symptoms, if you've gone 24 hours at that point without a fever or being severely sick, you're allowed to start integrating back into crowds. As far as when you're allowed to go back into exercise, that depends a little bit on person to person as to how severe your symptoms were. Do you have other associated diseases? Some people require more screening, chest x-rays, sometimes heart testing, things like that to make sure it's safe. But in general, 10 days after you've been sick, as long as the symptoms are mild, that's usually enough to come back into athletics.
There's a stringent return to play protocol for concussions. Is there any return to play protocol for COVID-19 recovery?
That's still a little bit in flux and being developed as we're learning about what the longer term consequences are of COVID. They need to have a good physical with the school physician. They need to have their lungs screened. Again, need to be kind of see if they need more testing for their heart or lungs. Sometimes people need more blood work to check their liver and kidney function. In contact sports, especially, that's important. And then we talk about lifestyle things as far as making sure they're getting a little bit of extra rest. And sometimes we will kind of gradually get them back into the intense physical activity, and they need to be monitored very closely. The protocols are not nearly as rigid at this point as they are for concussion.
Well, once again, we want to thank you for your input and education on the coronavirus, and we just appreciate everything you do for the community and our student athletes.
Thank you very much.